Remember the last time you had a headache? You really wanted to see a doctor. You were even confused what type of doctor you should see. You didn't know where to start. I will teach you how to get to the right doctor, how to get prepared for this doctor visit, and of course, the steps that the doctor will take to make sure that you get the best treatment. Most health problems like headache is subjective. This means that your doctor does not really know what is happening to you. He's not inside your body. He will use available information to get what is happening to you. They call this diagnosis. This process is very important before he gives you treatment. Now let's dive in. Whenever you are going to see a doctor or even considering seeing a doctor, you should choose one health issue or symptom, at most two. This is number one. This should be your primary concern. Do not choose too many symptoms. Just focus on the main symptom. Do not be tempted to go off this problem. Do not talk about other things unrelated to your symptom, like watching Barcelona versus Real Madrid. No one has time to waste. Number two is to learn how to describe this main symptom before you see the doctor. In this video, I animated how to describe a symptom to a doctor. You can use it as a guide. Many patients don't know how to present their problem to a doctor. This is why the letter will ask specific questions. These questions guide the doctor to the diagnosis and treatment. Doctors call this anamnesis. After the information gathering part, the doctor will move to physical examination. I call this part objective because the doctor, using manipulations, will try to gather more information. This is a very important step. The physical examination revolves around your main problem. Next step is complementary exams. These are specific tests for specific diseases. This is where some of your money will go to. People in better financial situation will have access to better diagnostic equipment and treatment in a place that have these tools. Depending on what you tell your doctor, he will ask for specific tests. The doctor uses these diagnostic tools to narrow the possible causes of your disease. With good diagnosis, treatment is usually straightforward in most cases. There are different modalities of treatment depending on the disease. Traditionally, treatment are divided into two parts. After treatment, many people feel the work is over. This is especially in the case of effective treatment. If patients get better, they disappear literally. It is important to have follow-up even after treatment, not only when things go wrong. Discuss this with your doctor for the treatment. Lastly, you should build confidence with your doctor. The best doctor is not the most intelligent, but the one you trust and can communicate in a way you will understand.